there are different relationships. One is obviously if you have HIV, you're more likely to be diabetic. So that's an important association. And in our diabetic clinic, about 13% of our patients have HIV as well as diabetes. That doesn't mean that you're more likely to catch HIV because you're diabetic, but if you have HIV, you're more likely to become diabetic.
The reason for this is twofold. Firstly, the HIV virus itself increases the risk of certain cardiovascular disease risk factors, including high blood pressure, diabetes, and high blood lipids. And this is shown in this graph. So these were people who were coming for their first ever HIV test, who didn't know their status beforehand. And before they had the test, they were tested for high blood pressure, they had a blood glucose and a blood lipid measurement. And as you can see in the graph, the red columns are those who tested positive, the blue columns are those who tested negative. And all of the red columns are higher than the blue columns, indicating that the prevalence of high blood pressure, diabetes and high lipids was all higher in those who tested positive than in those who tested negative. And this is thought to be due to an inaction of the virus itself on the body, possibly mediated through chronic inflammation. Now, on top of that, we also know that the drugs which are used to treat HIV can also cause diabetes. So after many years of taking certain antiretroviral drugs, the risk of high blood pressure, diabetes, and certain abnormalities of blood lipids also starts to go up.
The second association or similarity between HIV and diabetes is that they're both immune suppressing conditions. And in diabetes, the mechanism of this is that having a high blood glucose prevents the body's white cells, which are the body's defense mechanism, particularly a cell called the macrophage, from working properly. And that is manifest by the fact that diabetics are more likely to get infections. And then you may be familiar, they get fungal infections, particularly oral thrush or genital thrush. They can get abscesses, skin infections particularly, so abscesses, cellulitis, and these foot wounds that diabetics are more vulnerable to. But they're also more vulnerable to internal infections, so you're more likely to get pneumonia, you're more likely to get respiratory tract infections, urinary infections, and you're 3 times more likely to get TB just because you're diabetic. Now, some of those infections that I've mentioned are also more frequent if you have HIV. So if you have a patient who comes to your clinic and they've got oral thrush, say, now in the ARV clinic, that to you is a stage 3 condition and you think that my patient's immunosuppressed and they need to start antiretroviral drugs. In the diabetic clinic, it means that they've got poorly controlled diabetes. Now, if you've got both HIV and diabetes, it's very difficult for the clinicians to know which is contributing to your immune suppression. So we sort of advocate that all of our patients know their HIV status because it helps us to manage them better. And as well as infections, there are other symptoms which are common. So weight loss. Poorly controlled diabetics lose weight. People with untreated HIV lose weight. So there are other similarities which can be confusing if you don't appreciate perhaps that your patient has both conditions. Another sort of interaction between the conditions is in the development of long-term complications. Now, HIV is also a disease that damages small blood vessels, and there's a vasculitis associated with HIV. There's a nephropathy called HIVAN, HIV-associated nephropathy. But diabetics also get nephropathy, and we've actually shown in our clinic at Queen's that if you have diabetes and HIV, they're synergistically put you at increased risk of nephropathy, more than just an additive effect. So again, our sort of group with overlap of both conditions are a very special group of patients that actually do need more intensive control of their diabetes and more sort of intensive screening for complications because they are an at-risk group.